kind of a long story, so I'm going to just look down and read it to you all. So, during the critical care transfer of a patient, this nurse showed exemplary and very professional skills. This nurse went above and beyond, and I want to recognize this person. The patient that we were dealing with was on multiple IV drips, as well as a ventilator and a balloon pump. This creates for a struggle for a patient transfer because of all the details and pieces that need to go with the patient. This patient's illness was of greater critical status so that they needed to be transferred to a tertiary center. My air medical helicopter was dispatched for the transfer of this patient to a St. Louis hospital. When we arrived on the unit, this nurse jumped in and assisted. What we are used to is the nurse giving a report, handing off paperwork, and then resuming their own assignment as we, the AirEvac team, continue with working on switching over drips, transporting the patient to the stretcher, and ultimately to the helipad. This nurse was the exception to that, and the minute we hit the floor, assisted all the way from the floor all the way out to the helipad. Let me tell you a little bit more about this nurse. This nurse gave bedside report, and because this patient's situation was so complex, gave many more additional details to instruct us on what was going on with this patient. This nurse looked ahead to what medications might be needed in transport so that we did not have an issue while up in the air. This nurse gave additional information on the family and just gave us overall assistance, and then actually walked us from the ICU all the way out to the helipad in very frigid temperatures and assisted us with getting this patient with their mini drips, the ventilator, and the balloon pump into our helicopter. These were just a few of the many things that this nurse did in this transfer. I have been with AirEvac as a nurse for many years and have never seen someone go so above and beyond to assist us. Not only that, this nurse stayed very positive through this whole transaction, making the patient's well-being their utmost priority and making sure that we felt confirmed and affirmed of transporting this patient, making sure that every detail was taken care of. I would like to recognize this nurse for this exemplary success and working with us and being such a great nurse for this patient. So thank you very much from the AirEvac member, Blake Aubuschon. Congratulations. What a nice story. For sure.
Come on out, Blake.
Yep. You know the drill.